Welcome back. Now, the COVID-19 vaccine for children is safe and effective. It has undergone rigorous review and now has been authorized by the World Health Organization and recommended after testing for safety in thousands of children. The Namibian government continues to encourage 12 to 17-year-olds to get the Fisa vaccine with prior consent from parents and guardians before administration thereof. It's been over 2 months since the commencement of children's vaccinations in the country. For an update on the rolling out of the process, pediatrician Dr. Johanna Shapaka joins us now in studio to give us more. Good morning, doctor, and thank you very much for being here.
Good morning. Thank you very much for inviting me.
Right. Now, doctor, we've seen that with the Omicron variant, it has been infecting or has been more prevalent in amongst the children compared to other variants. So why is that the case?
Just to give you some background on Omicron, it's a very new variant. We've only actually discovered it in Southern Africa, reported first in November last year. So what we know is very novel, and what we know we continue learning. What we do see amongst children is that Omicron is very more transmissible. It has also got a reduced neutralization of antibodies. Therefore, the children are highly susceptible to getting the disease. What we also know is that the disease, though, we mostly pick it up on routine screening basis. And what we see is the children that are admitted for an elective procedure or come in with another condition on screening that pick it up. For that reason, we can say that the disease is actually quite mild in children. But obviously, we still have to be cautious with it.
Now, in Namibia, only children between the ages of 12 and 17 may be vaccinated. So what are some of the ways that can be practiced to protect children who are too young for vaccine right now?
Okay, you make a very good point, is that children that are 12 to 17, we can vaccinate because of the rigorous studies that have been done overseas. And for that reason, we've deemed it quite safe for children to get the vaccine. Moreover, the children that are not able to be vaccinated, and even adults are not able to be vaccinated, we should encourage other children that are eligible for vaccination, and in fact, adults as well that are eligible to vaccination, to vaccinate them. In this way, we can allow for herd immunity. Herd immunity essentially means that just like our childhood vaccine, say for example, like measles, is that if you can vaccinate 75 to 80% of patients or people, children in the country, you're able to protect the other children that are unable to be vaccinated, or even vulnerable adults that are unable to vaccinate. So what we would suggest is that those who are unable to vaccinate, for parents, please be careful. So follow the ministerial guidelines on prevention of COVID, wearing your mask, sanitize, vaccinate. And that way we can protect the younger vulnerable children. Obviously, parents that are breastfeeding are obviously going to be at higher risk to transmit the virus. For that reason, if they know people that are infected, they should not be in contact with them to prevent the child from being infected. So essentially, herd immunity would be the highest on our list. So vaccinate all people that are able to be vaccinated. And secondly, follow the ministerial guidelines to protect yourself so that you can protect your child.
Thank you very much for that, doctor. Now, we know that there are various vaccines on the market. Why is Pfizer the only vaccine for this group of children?
According to our rigorous studies that I've said, we've just mentioned, so the FDA has approved, in fact, 2 vaccines. It's Pfizer plus Moderna. The country, Namibia, has, however, chosen to use Pfizer because that's widely available, widely used, first of all. And second of all, the studies are way more stronger for Pfizer. Secondly, the efficacy rate that we've done in the studies that we've done, obviously we do adult study. It's not easy to do children's studies. So we do adult studies and then transport it into, translate into adult, into children. But also we know in the US, we've also done studies on children. So amongst all the studies that we've done, Pfizer has proven to be way more effective, safer, and obviously also a better vaccine to give to all the other, to the children. Moreover, if the country has to think about cost, we can import Pfizer, or in fact the donors have given us Pfizer. For that reason, we can not just vaccinate the children, but also elderly patients that are unable to get the other vaccines. And Moderna, not as very readily available, and also donors have given us the Pfizer vaccine. But moreover, Britain, US, South Africa, and all the other countries, obviously the other countries use others, but those other countries that use Pfizer, and for that reason, Namibia has elected to use Pfizer vaccination.
Now, for the parents watching or children themselves as well who are wondering what are some of the symptoms of a child with COVID-19 are, could you please talk to us about those?
Okay, so COVID-19, first the Omicron variant would follow the other variants that have been produced before. It's just that the Omicron is a little bit lesser or milder disease, so they will still have the same symptoms as the other variants, like your fever, your runny nose, your sore throat, the body aches, and your dry cough. Those are the main ones with the Omicron that we've seen. We have, however, seen that these symptoms remit quite quickly, 2 to 3 days remit quite quickly. The fever can persist for a bit longer. What we've also seen with the Omicron is a phenomenon we call pediatric inflammatory multi-organ syndrome, which is way lesser and lesser reported. And I've seen lesser cases, especially admitted to ICU, with this, what we call the PIMS or the MIC. It's lesser in the Omicron variant. So these are the symptoms we've seen with COVID-19 or the Omicron. But obviously, like I said, it can look exactly like the other variants. The key point is that it's milder disease.
Now, there has been reports that the Fisa vaccine has been reported to cause myocarditis, which is an inflammation of the heart. Is there any evidence of such in children?
Yeah, of course, the reports have been there that there are some few cases, and like mentioned, is the cases are fewer, or the ones, or say the mRNA vaccine, the Pfizer vaccine, those are really lesser that are present. However, FDA and obviously WHO, as you look at a risk benefit in giving the vaccine compared to the risk of developing myocarditis or pericarditis, the inflammation of the heart, or the inflammation of the membrane around the heart. So if you look at the risk benefit, the benefit that you're going to reduce your severe COVID, you're going to reduce COVID vaccination, COVID disease in itself, you're going to reduce the risk for MIS-C or PIMS, you're going to reduce the transmissibility, you're going to reduce, obviously, the indirect complications of COVID, like your school closure, like your isolation, like your quarantine, like in adults, your pre-morbid state, like if your return to your pre-pandemic economic stability, you're going to reduce that. We look at those risk benefits and we say that because this complication, myocarditis, is rare, it's smaller proportion, it's milder, way milder than other myocarditis caused by other viruses. We've elected that because it's so rare, it's so small, would not remove vaccination in children based on the small and rare complication that can occur. In fact, so far, the data that we have, we haven't described that in Namibia children yet. Yes.
Doctor, it is a known fact that COVID-19 spreads faster in larger groups, and schools are due to open today. So what advice do you have for parents and children to ensure that children avoid contracting the virus?
Okay. So I would still say that as parents, we should still follow the ministerial guidelines as we have done before. One, hand washing, sanitizing, wearing of masks. Even if you're vaccinated, you should still wear the mask to prevent reinfection and prevent spreading as well as hand washing. Playgrounds, minimal children on the playground, minimal contact with children in general. Obviously, it's very difficult, but if they wear the mask and hand wash, sanitize, it's obviously going to decrease it. And in fact, children that are eligible for vaccination, the 12 to 17-year-old group, we'd recommend that they get vaccinated to provide herd immunity for the younger children that cannot be vaccinated, as well as teachers should be vaccinated so that they can prevent spreading of the virus. What we've also seen that if you vaccinate the children, or even the adults, community spreading also reduces. Obviously, you can be reinfected, but the disease will definitely be milder and definitely will not cause the patient to go into ICU. So what we say is that those who are eligible for vaccination, please get vaccinated, adults and children, and follow the ministerial guidelines as prescribed before.
Thank you very much, Doctor, for making our time to speak to us this morning.
You're welcome.
Well, that was Dr. Johanna Shapaka talking to us about COVID-19, or specifically the Omicron variant, and how it affects children. We'll be back with the 7 a.m. news highlights brought to us by Denver Kisting. Stay tuned.
Hey boys and girls, protect yourself and others. Get vaccinated this festive season. COVID vaccine is finally available for children ages 12 to 17. Get vaccinated to end COVID-19. Get the right information on the COVID vaccine and get vaccinated to keep COVID-19 at bay.